to start recording this. Welcome. So great to see so many of you here. We're so excited to start recruiting for our 5th cohort already. Me and Clarissa can still remember when we were trying to find our first cohort. So it's great to now look for cohort 5. So I'm Sophie. I work at IGHI as operations officer and I manage a training program. So tonight I'm joined with lots of other lovely colleagues who will all introduce themselves shortly. We've got our trainees as well, and we've got the people who are leading on the projects. Can I have the next slide, please, Leo? Thank you. So just to give you a quick overview, today we're going to just share with you a bit about the training program and the roles that we have on offer. And there's also some time for Q&A. If you have any questions throughout the webinar tonight, there is a button, it's called Q&A, and you can pop your questions in there. We will be answering them throughout the webinar and at the end, but some of your questions might be answered whilst we're on this webinar. So yeah, just stay tuned and we might answer your questions already. But if you have anything, just pop them in the Q&A. Clarissa, would you like to get started with introducing the program, please? Thank you.
Thank you, Sophie. So yeah, if we take it back to, 2020 on the next slide, please. We saw lots of changes happening in 2020 around, social injustice, the impact of the COVID pandemic on work opportunities for young people. And one of the key things that we were reflecting on at this time is that there were many work experience opportunities for people who are at the early stage of their career that still require lots of years of experience. And also in the context of working in an academic environment, we also saw a lot less representation from people from certain groups. So Black, Asian, ethnic minority, people with Black, Asian, ethnic minority backgrounds, people who identify as LGBTQ+, or people who live with a physical or mental disability. And there's a real opportunity to bring these people into our work environment. And we felt like our institute was a great place to kind of do that, because we are a very multidisciplinary team of talented people who have come from different professional backgrounds, but as well very diverse lived experiences. So we felt that we were in good position to offer a process that could standardize and make it fair, the process of applying for an entry-level position, but also applying for an entry-level position is actually entry-level, so suitable for early careers folks. Next slide, please. So we went on to develop the concept of this program, which is that it offers paid work experience to people who have no or limited prior experience in our areas of work. We would design it in a way that people actually get to work on impactful programs of work that we do at the Institute, and use that to gain meaningful skills and hands-on experience that will kickstart their career. We sought to advertise the placements twice a year to account for different kind of seasonal job interest spikes, and we would allow between 8 to 12 weeks for each placement, so people get the most out of it. And then we also wanted to kind of add some other benefits in, like having a mentor throughout the placement, getting access to the training and internal vacancies that you would have access to as an employee of the university. We'd also give a certificate of completion just to celebrate this kind of milestone achievement. And as well, for those who do well, we would then provide a reference so that anyone can go on to do some other work that really fulfills them. Next slide, please. And it's been a real journey for us, and it's been a really proud achievement for us as an institute. I have to say, like, being in the space where we're kind of spitballing ideas about how we design this program. It really felt like it brought us together during quite a turbulent period in our lives with COVID and the impact of remote working. We, like Sophie said, are in the 5th cohort now, and since we started this off, we've won an award from the university. You can see us on the left getting an award from the previous president of the university for our work as a team. You know, of course, looking to the right, we are very proud that this program is a memory of our previous colleague, Julia, who passed away during the pandemic. And also one of the proudest achievements this year is that we won the Imperial College Equality, Diversity and Inclusion Seed Fund, which I think you have to remind me, Sophie, how many applicants there were and like how amazing it was that you guys got that funding.
It was amazing. There were 20 others and we were clearly the best.
Yeah, there you go. So yeah, we're really happy to continue offering this program, and we're really grateful for anyone who expresses interest in this, because we do want to reach people who are eligible for it. Speaking of eligibility, on the next slide, let's talk about it. So have to say that this is something that we've been working and evolving on since we launched the program, based on feedback, but it's also based on the process of going through applications. So the key thing that stuck with us is that in order to be eligible for this program, you must have limited prior work experience in the areas that we work in. So when we talk about health, science, technology, business management, when we talk about limited work experience, as a ballpark estimate, we're talking about less than 2 months of full-time employment. Kind of adding to that, we again really appreciate that opportunities like this are few and far between. So we're really focused on getting in people who've never undertaken a paid internship or a training program, again, around a similar time frame. You know, there's no age cap or, you know, that sort of thing to this program. We ask that anyone who applies is above the age 18 or above. We're, again, open to school leavers, but also open to, you know, undergraduates or graduates up to master's level, because again, we want to give this opportunity to anyone who really could benefit from it. Likewise, if you're in receipt of job seekers or universal credit, or if you're a career changer, you haven't got experience in those areas that we mentioned beforehand, please do apply. And again, another benefit of this program is that we always have had no minimum grades required for applying, just evidence that if you stated that you've undergone a qualification, you actually have that. And then there's, of course, depending on the training post that you want to apply to, specific requirements, and you can see those on the job description and the person specification as well. What we want to flag is that since the last cohort, we've actually adapted the eligibility criteria based on some observations we were seeing, and we no longer accept applications from those who have been studying medicine or dentistry. Now, that's a key thing that we want to reiterate here, because again, we want to focus on those who need a step up into the world of professional working. Vocational degrees such as medicine and dentistry are so well placed to help people get into a role and then diversify if they want to. So that's why we've changed the eligibility criteria this time around. And then just last of all, because this is a short-term placement at entry level, you have to have the right to work in the UK to apply for this position. It's unfortunately one of those things we can't work around just because of the laws in this country. But it does actually present an opportunity if, for example, you're an international student who is studying full-time. There are some workarounds that allow you to do paid work while you're studying in the country. More information about this can be found on the website as well if you need further clarification. What we also did on the next slide, we'll show you, is that in the application form, we give space for you to explain your circumstances if you think you may or may not meet the criteria and you still want us to make sure we consider your application. That's the place to put everything down and explain your situation. So please do make use of that. Because that's what it's there for. We appreciate everyone's got different experiences, and we just want to make sure we give everyone a chance who really deserves it. Next slide, please. So I'm going to talk very briefly about some tips for applying. So keep it simple. Please read the job description and the person specification criteria. On that criteria, there are essential criteria where it's like that's what we'll look for as a minimum across all candidates who apply for a trainee post. And then there's desirable criteria, which is like, it's nice if you have it, but it's not the end of the world if you don't. What we'd also advise is that you think about all your experience to date. So please don't feel that you have to kind of oversell, little things that you've done here and there, or that you don't have to include them at all because it might weaken your application. Really, because it's an entry-level role, we're looking for people to talk about things that they've done, whether it's, you've been part of clubs or you've been caring responsibilities for a friend or a relative. That's all relevant as long as it reflects the person's specification criteria. And then we also advise that you use the STAR model because that gives us really good context about the experience that you say that you have. So, talk about the situation that you've dealt with, the task that was given to you or that you had to do, the action that you took, and then what the result of that was and what you kind of learned from that. So that in your written application will give us a good idea of kind of who you are and what you have to bring and where you want to grow. And then to help you make sure that you have all your ducks in a row before you complete the online application, we've provide a template for you to download from our website, which can help you prepare your application. By all means, you can take it to get feedback at your career service or job centre. You can also get people to proofread it if you want a second opinion. So please do make use of that because we hope it will be helpful. And then moving on to the next slide, please. So we've also put together a list of frequently asked questions on our website. So you can take a look at those. For example, if you have some queries about eligibility criteria, that's a great place to first get to see if you can get an answer. Likewise, we've got some other resources on our website that are really helpful in general. So thank you for listening to me. I'll now hand over to Sophie, I assume.
Yes, I think Rao is going to take that one.
I'll now hand over to Rao.
We'll give her some work as well for her final day with us.
Yeah, exactly. Thank you all. So to quickly introduce myself, I'm Rao. I'm the Julia Anderson operations trainee. So now I'm going to introduce you some about our timeline for the next cohort. So currently we have opened our application until 11th of October. So after that, it will take us 1 week to shortlist until 23rd of October. So hopefully you will receive the outcome from 30th of October. We will try our best to shortlist and give you the outcome as soon as possible. If you receive the invitation to the next round, then you will be invited to a HR webinar, which will happen on either 6th or 7th of November. So after that, there's going to have an interview between 13th and 27th of November. So after the interviews on 27th of November, you will be informed of the outcomes, and if you will be invited, if you are successful, so they are going to have some references and qualifications checks, and hopefully you will start your training post on 15th of January on 2024. So during this application process, if you meet any technical issues with your application, for example, the form, the Imperial London website, you can contact the first email here. And if you have any specific questions related to the program, for example, the roles and the eligibility criteria, please email the second email. Please email the second email address, which is the Sophie's email address. And please do not leave your application to the last minute, because just in case there are any technical issues will happen. So
thank you. That was
Thank you.
great. Thank you so much. So now we're going to hear from those who have going to take on a trainee. So we're going to hear from the project leads. And first we're going to start with Emily and Victoria, who are hosting a comms trainee.
Hi everyone, thank you so much for joining today. I'm Emily. I'm the Communication and Events Officer at the Institute of Global Health Innovation, or IGHI. And yeah, we're going to be hosting the Communications trainee. On the screen, you can see the Communications team at IGHI. So that's myself, Victoria, the Communications and Stakeholder Engagement Manager, and also Peter, who's a Managing Director for the Centre of Health Policy. And you'll be working really closely with us, but also you'll be working with other IGHI staff and researchers, as well as the Faculty of Medicine Communications team and the Imperial Central Media team as well. So in this role, it's a great opportunity to meet loads of people. So what will you be doing? What do we do? So at the IGHI, the mission is to transform health and care for all through evidence-based innovation. And in the communications, our role is to make sure that the brilliant work of the Institute is heard. So there's a big list there that we do. So communications planning, strategy, and analytics. We run the Institute social media pages. We put on events both in person and online. And we promote new research and policy papers through news and media releases. We also maintain the websites and the blog, produce multimedia content, have newsletters, and also support in making printed materials as well. So really varied, a lot going on. Next slide, please. And in terms of your role, you will be helping us working on all of these things shown in the previous role. So working on a range of communications and events projects with a range of people. And it's going to be a really varied role, and we really want to kind of support you with what you find interesting. I'm going to run through a couple of examples of projects that you'll work on, but it will very much be based on what you want to do and what you want to get out of the role. So one example is social media management. So you can promote on our Twitter or X channel, LinkedIn and Instagram, our events, research, media features, etc. And really use your creativity to come up with new ideas to engage our audience, and also look at the analytics as well to see how we're performing. You will have the opportunity to write up a student or researcher profile or blog post, so a chance to interview someone about all the work they do, write it up and promote it. Also looking at website management, so making sure that our web pages are all up to date with the latest content, and making sure that they're accessible for everyone as well. And finally, an example of multimedia content production. So you'll get the opportunity to support our Hamlin Centre's Robot Talk podcast, or record an audio interview of your own with some researchers as well. Next slide, thank you. So why should you apply for the communications trainee role? Well, firstly, you're going to gain a range of skills. So to list a few: interviewing, written communication, social media, events planning, proofreading, but many, many more. And by doing this, you'll be playing a really vital role in communicating groundbreaking work in global health. Like, it's really exciting to be working at a university, at a research institution in science communication, and it amazes me every day the types of things that we get to see and help share with the world. And finally, you'll be working in a fabulous supportive team environment. Next slide, please. So who are we looking for? We're looking for someone who has already shown an interest in writing or communications. So this could be experience writing for a blog, for social media, for a university magazine. Doesn't have to be this, like these are just examples, and we really welcome other examples of your interest in communications. An interest in science and health research as well would be desirable. Another really key skill would be creativity and initiative. We really want to welcome your ideas to the role. And also another key skill, excellent attention to detail and proofreading skills is really important, because obviously we're putting content out to the world, so we want to make sure it's perfect, basically. Strong organizational skills, so really, really important that you'll be able to work efficiently on several projects at once. As you probably have gathered, we're a busy team, there's a lot going on, so that's a really key skill that would be great for you to have. And finally, be great if you're a strong team player too. I think that's the end of my slides, so just want to say thank you for listening, and really looking forward to seeing your applications. And if you have any questions, please pop them in the chat and we can answer them. Thank you.
Thank you, Emily. And we'll pass on now to Matt, who will talk about the Healthy Aging Technology Trainee.
Hi, everybody. My name's Matt Harrison. I'm a designer, and I've been part of the Institute for 10 years. I work in the Helix Centre. Helix Centre is one of the centres that make up the Institute of Global Health Innovation, and are with sort of the design technology team, if you like. We're a mixture of designers, technologists, software developers, researchers, all trying to create design products and services that help improve health and healthcare. So we do have a helixcentre.com website if you want to see a little bit more about the centre in general, or just search Helix Centre, you should be able to find it. And we are also part of the Royal College of Art and Imperial College together. So we sort of span art and design in healthcare. Next slide, please. So this particular project is quite a new one for us. It's a multi-year project, and we're just getting, ramping up and getting going with it. It's a collaboration with a company called Optum, who are a US healthcare innovation company, part of United Health. So they're a health insurer in the US, but they do a lot of innovation research, and they bring skills, particularly around artificial intelligence and machine learning, and they're interested to see how they can work with us as designers with access to the NHS and UK health system to create innovative products. And this project, I think the next slide, well, this is what the team looks like at the moment. This is the internal Helix team, and you can see that we're made up a bit of designers, researchers. Damien's a software developer, and then the two in pink that we haven't got photos for are NHS geriatricians working in St Mary's Hospital alongside us on this project. So we've got a friendly mixed disciplinary team working on this project at the moment. Next slide, please. So the aim of this project is to look at how we can use technology in people's homes, so remote healthcare monitoring, to prevent older people from becoming frail. So there's a period in our life where you are at risk of your health, general health, deteriorating quite quickly. And what we want to do is use sensors in the background of people's homes or through devices that they use every day to see if we can identify people who are at risk of this sudden deterioration or quick deterioration, and then see if we can encourage them to adapt their lifestyle to help prevent that. So we're talking about preventative healthcare and using affordable technology that's acceptable to people in terms of privacy and usability and acceptability to help them stay healthy. Next slide, thank you. So why do we want to do that? We want to help maintain and improve both physical and mental health. We know that they're very linked in people as they age, so that they can live well and live independently for as long as possible. We want to find ways to identify and catch problems early. So, thinking of things like, risk of having falls, so you might injure yourself. So we're looking for things called digital biomarkers, which are signs in the data from people's homes that indicate that they are at risk. And we want to understand how older adults will engage with different types of sensors and technologies if they're introduced to their homes. Okay. So what do these devices look like? We're not inventing new devices in this project. We're looking at using affordable, low-cost-ish in terms of healthcare costs, low-cost things that are generally available at the moment, but using the data in innovative ways. So we're looking at things like wearables and smartwatches. We're looking at motion sensors in the home, door sensors, things like that. maybe physiological devices like blood pressure monitors and scales. And actually today we've been having some of our first workshops with members of the public to really explore which of these devices are attractive and acceptable to people in the way that we want to use them. Next slide, thanks. So this is just to illustrate really that this is part of a big project, and you know, this is a timeline going from left to right. We're expecting it to be at least 2 to 3 years, and we're in the pilot phase, or we're aiming for a pilot phase at the moment. The pink Julie Anderson trainee program window, it coincides with our pilot project. It's when we want to have the first technology that we select in the homes of the first 10 to 20 people in the community, and just doing those first trials to see if it works, to see if people get it, to see what feedback people might have when we put the devices in their homes, and to see how well they can use the technology and how useful the data is. And then in the future, it will turn into a bigger study to see if it's useful and to see if it helps prevent frailty, and then eventually a clinical trial. So it's an exciting time to join the project, where we're really sort of shaping what it's going to be and working with people in the community to get feedback. Next slide, please. So what would your role be? Is to support us and our team in that pilot of working with 10 to 20 people in their homes to test this technology and get their feedback. So we would like someone who's interested in working in this team and in quite practical aspects of it in terms of communicating with the people who are testing it. It might be coming on home visits to help install and maintain the equipment. It might be monitoring the data coming from the home to see if it's working as we expect it to, and communicating with the participants to support them, and then helping get feedback from them as the pilot sort of evolves. So feedback interviews and perhaps workshops around that. So quite an interactive role, quite technical. You hopefully wouldn't be stuck in an office at a computer screen all day. It'd be about going out there and speaking to people and plugging things in and seeing if they work. Next slide, please. So hopefully the role will give you experience in that multidisciplinary team. You'll have access to designers, academics, clinicians, software developers, see how they work together. You know, we have this, if you're interested in a role, look up this idea of human-centered design, try to understand what that means. This is about designing products and services that put the needs of the user as the main driving force behind them to create things that are acceptable. It's going to be an introduction to the role of technology in the future of healthcare, and that's a big subject. We're really at the cusp of a change in the way that we deliver healthcare, and this is part of that. And you should get some experience of qualitative research, especially with older participants in our community. Next slide, thanks. So a role will require, we'd like to see a demonstrable interest in technology, health, or human-centered design as a process. Someone who's positive, inquisitive, willing to learn from others. Organizational skills will be useful, especially as you may be handling confidential data, and good people skills. We need someone who we can feel confident talking to older people about getting old and health and things like that. So we want somebody who's going to be comfortable both in person, on the phone, and by email. Thank you. And if that sounds anything like you, we'd love to hear from you and see if we can help you join our team for a few months. Thank you very much.
Thank you, Matt. We're now going to go to Javi and Magda. I think we've got them both here, so they're going to present the behavioral science trainee role.
Hi everyone, welcome. So Javi and I are both PhD students at Imperial, and Gabi, who is not able to join us today, is our supervisor and is a lecturer in behavioral science. So I am a nurse by background, and I'm due to start my PhD next week at Imperial, and my project is looking at parties and facilitators of treatment adherence. And then Javi will introduce herself.
Hi everyone, I'm Javi. I'm a psychologist by background. I did an MSc in behavior change some years ago. And now I'm heading to my second year of PhD, working in behavioral science. So yeah, we have like some interesting opportunities for you. So let's go to these opportunities. Okay, so Magda and I are working in two related projects. We are both aiming to tackle heart and circulatory diseases. Those are big problems in the UK, causing a quarter of all deaths yearly. And one way to manage is like reducing cholesterol levels in patients, because reducing the cholesterol levels enables to reduce heart attacks and strokes. One very common medicine that it is like prescribed to 7 or 8 million people in the UK is called statins. And 200 million people in the world are currently taking statins, but unfortunately, like between 2 or 1 years, like most of the people discontinue the treatment and don't take their medications as prescribed, reducing, of course, their benefits from their medication. So my project is looking at understanding what are the barriers and facilitators to statin adherence, which means taking the medication as prescribed and then designing an innovative solution using human-centered design and behavior changes frameworks. There are many reasons that explain why people don't take their medications, such as misunderstanding about statins, fear of side effects, or just forgetting to take them. Those barriers are mainly psychological, so for that reason, we are using a psychological approach to understand the problem. And which is interesting is that different groups of people have different barriers. For instance, women and ethnic minorities have different barriers, and both groups also have a higher risk of CVD, cardiovascular disease, which is, so there, those groups are the target of our intervention. We are aiming to understand the barriers of groups that have not been researched in the past, to design a solution that can be tailored to those specific barriers. We are going to use like some different approaches, co-design, psychology, of course, and qualitative research methods to understand the different determinants behind statin adherence.
And my project is looking at the specific aspect of cardiovascular disease. You can see on the left-hand side of your screen, there is basically a normal artery and a blocked one. And this is mainly in the legs of the patients. It's very common. It's 1 in 5 people above 60 in the UK can have peripheral arterial disease, or PAD for short, which is the condition I'm looking at. Half of these patients within 5 years of the diagnosis are going to have a heart attack, stroke, or amputation. And we know that if they follow the treatment plan and take lipid-lowering tablets, which is a statin, quit smoking, exercise, and take some other medication, they have 40% reduced risk to have a heart attack, stroke, or amputation, or die. And during my pilot work, I was trying to identify some determinants of non-adherence using behavioral science, but now I'm going to do the more in-depth work during the PhD. Next slide, please. So as Javi mentioned, both of us, the aim of our PhDs is to develop personalized interventions to support treatment adherence. Mine is specific for my condition, and Javi's is specific to statin adherence through a digital intervention. In my project, during the first month, we will search the literature to find other studies in the population that I'm looking at to see what previous people did, what worked, what didn't, and if we could implement any of the characteristics of the studies that worked into our usual clinical practice at the NHS. And Javi will then be conducting some qualitative work.
So yeah, in my project, we already did like a systematic review, big systematic review, where we identify all the different barriers that faced by different groups of patients. So now we are conducting interviews targeted at those groups that have been not researched in the past. So my work will involve like interview analysis and also focus group planning and co-design planning, because we're aiming to conduct some like 12 or 10 co-design workshops in future. But lately it will be like interview analysis. So qualitative research is some of the tools that we are going to learn in if you join to our project.
And next slide, please. So the benefits for you, obviously you will be working with us. We are very passionate about what we do and friendly, and we do have a team spirit. So you will be able to gain a lot of skills, team building, collaboration, but also the research specific skills that you will be able to then transfer in other areas. It doesn't have specific to be in behavioral science in the future. And also there will be a chance to meet our collaborators and partners, including the NHS, industry, collaborators and charity organizations. But also you will be involved in 2 separate projects. So this will mean you will have the opportunity to publish in academic journals and also submit to conferences, and we will support you with that opportunity.
We are looking for those interested in health behavior. You don't need to have like a background on behavior change or psychology. So because we will learn together how to to apply the tools that we are using in our projects. But we also we do want to have people that is interested in working in a team. We're a team. Magda and I work together, and we also work with other people or other researchers. So yeah, we value the ability to work in team in a collaborative manner. Also, good written and oral communication is a must, because we are doing like systematic reviews, literature. So we will need to develop like reports, create reports, and also like presentations to our research group and like other audiences as well. And also, but like most importantly, we are very interested in having people that is keen to learn, that want to learn and about like this innovative approach to healthcare, which is like something that it has developed during the last 10 or 8 years. So yeah, we will be very happy to have people that is keen to learn something new and interested in this innovative field.
Thank you. And that's us.
Thank you.
Great. I had one question in the Q&A for you two, Magda and Javi. Someone is asking, are there particular behavior change frameworks or theories that this project is using?
Yeah, I'm using the behavior change wheel from Susan Michi, which is one of the frameworks that is most used in this field, in medication adherence specifically as well. And we also are using like the theoretical domains framework to analyze interviews, and the combi model, which is part of the behavior change wheels. But like all those tools are related to the behavior change wheel. So yeah, we're gonna provide training on those tools, because those are like one of the core parts of our projects.
I am using different frameworks, so the individual, although it might sound a bit overwhelming, they will be exposed to different frameworks. So I'm using the person-based approach to develop my intervention, but specifically for the systematic review, I will be using a framework that is it's called Perceptions and Practicalities Approach. PAPA for short, is on the NICE guidelines for medication adherence, and also the theoretical domains framework.
Lovely, thank you.
We can put them in the chat if it's easier for people to see them.
Thank you very much. Now I'm going to pass on to our current trainees, and they are going to share with you a bit about their experience and also give you some tips which helped them when they applied for the role. So I'll pass on to Rose, CJ, Beatrice, and Martina.
Thank you, Sophie. Hi everyone, I'm Rao. So I would like to introduce you some of the tasks I've done during the role as the operations trainee. So basically, I've done 3 main things as the role. The first one is organizing the logistics of the 5th cohort of Julia Anderson trainees. For example, I did it from calling for new projects from our project leads, and I coordinated with the panel shortlisting to help it move forward. I also helped to draft the job descriptions and job adverts to posted the roles to the website. Besides that, I also did some job advertisement to different university career websites to make our roles to be seen to as many people as we can. And another thing I did about the new cohort is that I drafted an EDI survey for the future applicants, which is a very important thing to help us improve our program in the future. So secondly, I did some marketing and communications work about the program, which is the biggest achievement of me during the role as the operations trainee. So as you can see from the picture in the middle, it is my Instagram takeover day. So I worked with my fellow trainee Martina, and we finished this Instagram takeover. And the second picture is the blog post I have written for the current trainees, and I listened the stories from them, and I found I would like to share their stories and journeys. So here's are they. And the right picture, as you can see, is a video series of our EDI videos. Which is a new outreach project we would like to develop in the future. So for my role, I coordinated this video shooting, and it is very successful. It will be posted soon, hopefully. And for the last task I've done is to help coordinate the EDI high school outreach project. So this project is aimed at helping final year high school students to by talking with them about their career prospects and encouraging them to apply for the Julia Anderson training program. So this is basically my role, and I feel I'm really happy with the journey, and because I've done lots of new experience from it. According to my suggestions, I would suggest, firstly, make sure you do some research before you apply for it, because the more you learn about your role, the more you can make your stories more personalized and concise. So my second tips would be keeping the answers specific, concise, and personalized, because it is very important to let our shortlisting panel to know why this is an important opportunity to you and how the program could support you. So I would suggest you to keep it specific, concise, and personalized. Thank you. So now I'm going to pass it to my fellow trainee, CJ. Thank you.
Thank you. Oh, can you see me? Hello? Oh.
Yeah, it's all okay. Yeah, we can see.
Okay, great. Sorry. Thank you. Okay, so I'm CJ. I am the Change Lab trainee. So in my role, it was mostly research based. So I don't have much like evidence and like pictures of what I've done, but I've done quite a bit while in my role. So my main project was Concentric, which was helping to come up with behavioral interventions to get clinicians like surgeons and nurses to use a digital platform more often to do like consents for surgeries. So that's what Concentric is. I also did like a systematic review, like mentioned before. It's quite important to do that when you're doing research. And then I did a lot of thematic analysis. So because I was working with behavioral interventions, we matched those to the COMBI framework more often. So I would do the analysis of the feedback that we got from the interviews, and then I would match those to the COMBI framework. So I did conduct like interviews with surgeons, which was pretty cool because I met like plastic surgeons and like heart surgeons. So it was really cool for that. But there was a variety of projects that I was able to have a hand in, which was really lovely. And then while doing this, because I was mostly research based, I enhanced my academic writing skills and analysis skills. So it was quite like important for me to get those because I'm currently studying psychology and criminology at uni. So it was quite nice to see the stuff that I was learning about to be used in like practical senses. And yeah, and it just enhanced like the whole experience of like what I've learned in uni to real world application really. So my tips for applying would be to focus on the question and try and not trail off, because that was one of my problems that I had. It was to keep like trailing off and being like, oh, I did this, and it kind of just went into like a whole like kind of like long story. So like try and be focused on the question. And then I would say when I was trying to come up with stuff that linked to the question, like teamwork or something like that, I was finding it hard. I was like, I swear I've done teamwork. So I would say make a list of everything that you've done so far and all the skills that you want to develop or have developed already, and then kind of just match them to like the questions. It makes it quite like easier just to kind of like compartmentalize it, and it helps like come back, and then you'll find it much easier when you're writing your application. So yeah, those are my tips. Pass on to Beatrice.
Yeah, thanks, CJ. So hi. Sorry. Sorry, everyone. Hi, everyone. My name is Beatrice, and I worked as the Julia Anderson Helix Center trainee. So my main role was designing a behavioral science intervention. And I would just like to mention that before coming into this role, I basically had no design experience. So this is just like a really great opportunity to kind of like develop the skills you don't already have. And this is like a great kind of entry level role. So more about like the projects that I mainly worked on here. So the main project I worked on was called DNA Inequity, and DNA stands for did not attend, which is basically the people who do not attend their hospital outpatient appointments without like cancelling or rescheduling. And this leads to inequity because people cannot or like are unable to receive the care that they might need, or like they might get drops from the list if they like do not attend like many times. So we worked on designing a behavioral science intervention to kind of help people overcome the barriers that they may face, which leads them to not attend their appointments. So for example, some people struggled with getting transports to their appointments, or some people struggled with trusting the NHS, or they were apprehensive about going to their appointments because they didn't know what to expect. So the intervention that I was leading the design on was called the What to Expect intervention. And we made a text message and a website intervention, which is going to be trialed later on, I think early next year. And basically in this intervention, it's like an introduction to the hospital staff. So like the patients are more familiar with the people who will be taking care of them when they're at the appointment. And also there's a kind of like introduction of what they can expect, so they can feel less apprehensive about the whole experience, and they can just like foster trust between patient and the healthcare services. I've also worked on like a couple of different projects. So this traineeship has been a great opportunity for me to like work on a variety of different things and also develop like many different skills. So I also worked on a PPIE project, and PPIE stands for Patient Public Involvement and Engagement. And it's basically just about like working with the public and designing things that are actually like made for the public and tailored towards like their experiences and what they need. And basically this project was about creating a resource that researchers can use to conduct this kind of interaction with the public. And yeah, next slide, please. So onto my application tips. I think my first tip would be to make sure that your answer is always personal to you, and like you actually talk about your experiences. So like if a question asks like, oh, how are you applicable for this role or something, instead of just saying like, oh, I'm organized, like I'm good at teamwork, you like really should showcase like, how are you organized? Was like there an example of like you like doing some work where you were very organized, or you like multitask or something like that, and like there was like a teamwork scenario, like how did you showcase this, like what was the scenario, and really like break it down and use the, I don't remember like the acronym that they like refer to at the beginning of the slides of this webinar, like really use that and actually like talk about your actual experience and like make it very specific. And then my second tip is to like read the role specification and actually pick out the key points they're looking for. So and it's like really good to use the language that they used in the kind of role specification. So for example, if they're looking for like human-centered design, like use those words and like really make sure that the person who's reading your application like knows what you're saying and knows like the things that you're targeting, the things that you're kind of like showing that you can do, or the things you're interested in. So yeah, that's it for me. Passing on to Martina now.
Thank you, Beatrice. Hi, everyone. My name is Martina. I'm the Communications and Operations intern at IGHI. So I initially applied for the operations trainee role and got to the interview stage. However, I didn't get that. Fortunately, I did stay in touch with Sophie and found out that I might be able to help out during the summer on a part-time basis. So I did work with the communications team, so Emily and Victoria. My tasks there included most of the things that Emily specified for the next trainee. So that's social media content creation, website analytics, and social media analytics. I also got to attend the STIMETS event with Emily and support the STIMETS organization throughout the event. The second part of my role was working with Sophie and Rao. So one of the things I worked on with Rao closely was the Instagram takeover. So we did an Instagram takeover of the main Imperial account and talked about this program. And my last task was working with Rao on the program outreach planning. So that was really fun and really rewarding. My time here has been really fun. So whoever the next communications trainee is, you're gonna have a great time. You're gonna work with an amazing team, a supportive team, and you're gonna get to work on these really fun tasks. Now can we go on to the next slide? So my application tips would be when reading the application questions and when answering them, do reflect on your everyday activities, hobbies, volunteer work, and personal interests. You don't have to have experience. You don't always get experience from work or paid experiences or education. You can gain skills and knowledge from your everyday life and do really use that when filling out the application. And my second tip would be, before submitting the application, if possible, get feedback on the answers. It is really helpful to have someone review them, and it's really helpful in the aspect that someone can catch errors that you might have missed. So yeah, thank you.
Thank you. That was great advice. I couldn't have given it better myself. And you're not released yet because there's a question in the Q&A for you. So someone's asked if they're comfortable sharing. I'm interested to know what the recent trainees plan on doing after their roles in the training program, whether in the immediate future or down the line. So go for it. Anyone? Rao, Beatrice?
Yeah, I can go. So I am a biochemistry student at the University of Manchester. So I will be starting my final year now, which is my master's year. So I'm on an integrated master's program. So right now I will be doing that starting next week. But after that, hopefully I will be applying for grad jobs and hopefully stay in the UK and work.
Rao, do you want to go next?
Yes, sure. So I studied education at a University of Bristol as my master's degree. So after that, I also went to UCL, studied another education related course called PGCE Primary, which is not relevant to my current role at all. But I would like to try something different, especially beyond education. So I applied for this role because I'm very interested in the operations, human resources, and marketing, this kind of thing. And for my next step, because currently I already graduated from the uni, so as a recent international student graduate, I'm going to look for permanent long-term job and to continue my job application. Thank you. I hope it helps.
Cool. CJ?
Well, I'm in my last
can go
year
next.
studying psychology.
So I'm also currently in uni. I'm studying psychology at the University of Bath. So I'll be going back to university after this and finishing my final year. And then like further down the line, I'm planning on like finding a job, and that's probably like, I'm still figuring that out. It's probably in the realm of like behavioral science, service design, UX, that sort of thing.
Thanks, Beatrice. CJ, to continue.
Yeah, no problem. So I'm studying psychology and criminology in uni, and I'm going into my third year. So I'm going to carry on doing my volunteering and building up my profile as much as I can. But other than that, I'm looking to join like graduate schemes after leaving uni, and then furthering on to go and do my master's if necessary.
Thank you. Sorry, just see Beatrice's face, that makes me laugh. Thank you, everyone. So just wanted to recap, we've received some questions throughout the webinar on eligibility. So do read the eligibility criteria on our website. But to summarize, if you have less than 2 months paid work experience in a field related to healthcare, science, technology, business, then you're not eligible. If you, for example, have worked in a cafe for a few months, then you are eligible. But yeah, if you go to our website, then you'll find most of the eligibility criteria there. If you still are in doubt, do send me an email. I got a question now, which is what would be the weekly time commitment. So our roles are 35 hours a week. So I'm aware that some international students are only allowed 20 hours per week during term time. So then you can get in touch with us because we've had hosted previously international students who've worked 20 hours per week. But yeah, do have a read on our website before you, if you're in any doubt, do send me an email. We will share the recording as well, and it will be published on our website. And I think they're going to be sent to everyone who signed up to the Eventbrite. I'm just checking with Victoria, Emily. I think so. If not, it will definitely be on our website. But yeah, let me know, do email me. I'm going to write my email address in the chat as well. If I can work it out in a second. So this is my email. So do send me an email if any questions. The deadline for applications is the 11th of October at 11:59 p.m. in the evening. But please do not wait until the last second to submit your application because we can't accept late applications. And yeah, thank you so much for joining, everyone. We hope you find it helpful. And yeah, we look forward to receiving our applications and hopefully meet you at an interview stage. Thank you so much.